Algophobia is a specific phobia that involves an excessive and unrealistic fear of experiencing pain. This fear can manifest in a variety of ways, including fear of experiencing physical pain, fear of receiving medical treatments or procedures, or fear of having a serious illness. Individuals with algophobia may experience a range of physical and psychological symptoms when faced with the possibility of experiencing pain. These symptoms can include rapid heartbeat, sweating, shaking, and difficulty breathing. They may also experience intense anxiety or panic attacks when faced with the possibility of experiencing pain. The specific causes of algophobia are not well understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some researchers have suggested that the fear of pain may be a learned behavior, passed down from parents or caretakers who have experienced pain and have taught the individual to be afraid of it. Others have suggested that a traumatic event involving pain may trigger the development of algophobia. It is not uncommon for individuals with algophobia to avoid certain activities or situations that may lead to the experience of pain. For example, someone with algophobia may avoid going to the dentist or may avoid going for a physical examination at the doctor's office. They may also avoid participating in sports or other activities that may result in physical injury. The avoidance behavior can significantly impact their daily life. They may also avoid going for necessary treatments, which may make the condition or illness worse. This can lead to a downward spiral where the person becomes increasingly isolated and their physical and mental health declines. The impact of algophobia can be significant, affecting an individual's ability to lead a normal life. Individuals with algophobia may avoid seeking medical care or treatment for fear of experiencing pain. They may also avoid participating in certain activities or may have difficulty completing tasks that may result in pain. Algophobia can be treated through a combination of psychological therapies and medication. One of the most effective treatment options for algophobia is cognitive behavioral therapy (CBT). This type of therapy helps individuals identify and change the negative thought and behaviors associated with their fear of pain. CBT involves working with a therapist to identify the negative thoughts and beliefs that are associated with the fear of pain. The therapist will then help the individual to challenge and change these thoughts and beliefs. This can involve gradually exposing the individual to feared situations in a controlled and safe environment. By confronting the fear in a controlled and safe environment, the individual can learn that the fear is not justified, and they can learn to manage their fear more effectively. Exposure therapy is also an effective treatment for algophobia. This approach involves exposing the individual to feared situations in a controlled and safe environment. The goal is to help the individual learn to control their fear and reduce their symptoms. This can involve gradually exposing the individual to feared situations, such as visiting the dentist or receiving a medical treatment. By confronting the fear in a controlled and safe environment, the individual can learn that the fear is not justified, and they can learn to manage their fear more effectively. Medications, such as antidepressants and anti-anxiety medications, may also be prescribed to help manage symptoms of algophobia. Medications may be used in conjunction with therapy, or they may be used on their own. Antidepressants, such as selective serotonin reuptake inhibitors (SSRIs), can be helpful in managing anxiety symptoms, while anti-anxiety medications, such as benzodiazepines, can be helpful in reducing symptoms of panic. In conclusion, algophobia, or the fear of pain, is a specific phobia that affects many individuals and can significantly impact an individual's ability to lead a normal life. It is a complex condition that is believed to be caused by a combination of genetic, environmental, and psychological factors. The physical and psychological symptoms associated with algophobia can be severe and debilitating, and they may lead to avoidance behaviors that can further exacerbate the condition. Effective treatments for algophobia include cognitive behavioral therapy (CBT) and exposure therapy, which focus on helping individuals identify and change negative thoughts and behaviors associated with their fear of pain. Medications, such as antidepressants and anti-anxiety medications, may also be prescribed to help manage symptoms. It is crucial to seek professional help in order to properly diagnose and treat algophobia. With the right support and treatment, individuals with algophobia can learn to cope with their fear of pain and lead a normal, healthy life. In the final note, it is important to take the fear of pain seriously and not to dismiss it as trivial, as it can have a significant impact on an individual's quality of life. It is essential to seek professional help from a mental health professional with the expertise in treating specific phobias in order to learn coping strategies and overcome the fear to improve one's physical and mental well-being.